Hello, and welcome back to the Healthcare and Healing podcast.
I'm Isabel.
I'm Dana.
I'm Kira.
I'm Crystal.
I'm Rose.
And I'm Molly. I hope you all have been enjoying the Healthcare and Healing podcast. Last episode, we delved into the background on European healthcare systems. Today, we'll be taking a deeper look into the initial reaction of the pandemic and the events of 2020 in January through July, which are now known as the first wave. Why don't we start by discussing how your country handled the earliest cases? Crystal, I know France was the first country in Europe to discover COVID, so if you want to talk to that first.
Yeah, of course. So France was the first European country to confirm its first and second cases in Bordeaux. And this was on January 24th, 2020, so very early on within the pandemic. So they also advised against travel to China on February 4th, but it was too late as community transmission was already starting to ramp up, and France reported its first death on February 14th from COVID.
Yeah, and I think Germany was next after in terms of the countries we looked at. So Germany's first case of COVID was detected, looks like 3 days after France's first case, so on January 27th, 2020 in Bavaria. And the patient zero was a Chinese resident who visited Germany for professional reasons, so traveled over from China.
And that's actually a similar thing that happened in Italy as well. So the WHO declared COVID-19 an international concern on January 30th. And at that point, Italy had 3 confirmed cases that were all due to travel to and from China. But February 20th, 2020 was actually their first confirmed case in Italy. That was an Italian resident.
Yeah, so following just about exactly the day after it was declared an international emergency, the UK had their first case on January 31st, 2020, and on that same day, the country raised the national threat level from low to moderate. But this is still about a month before real government action began.
Spain's first COVID-19 case was also recorded on January 31st, 2020. And Spain's patient zero was a German tourist visiting one of the Canary Islands, which is off the coast of Morocco. And the country experienced its first COVID-19 death on February 13th, only weeks after its first case.
It looks like Lithuania was a bit late. They actually did not confirm their first case until February 21st, 2020. And then days later, the government declared a state of emergency on February 26th.
Yeah, so it's really interesting to hear about exactly how it started in all of these countries. But so prior to COVID becoming a public concern in the West, just as it was starting out in these early months, what was your country doing to prepare would be my next question. And I guess I can speak to that first, is the UK. And pretty much, unfortunately, similar to the other European nations, the UK was not actively preparing for a pandemic at the time. One anecdote on the UK's pandemic preparedness is the comparison one can draw between Singapore and the UK. Dr. Martin Hibbard, an epidemiologist of the London area, had traveled between the two countries in the early 2000s. And in this time, he was helping Singapore design a pandemic plan. What they ended up with mirrored the UK's plan almost exactly. But when it came down to the pandemic, comparing the 34 deaths of Singapore with the over 128,000 deaths of the UK, it's clear that the difference may have simply been in the fact that the UK had a plan and Singapore actually used one. At this time also, despite weeks of scientific advisory group meetings beginning in January, it was not until early March that Boris Johnson attended one, and that was already after the first British death due to COVID.
Spain, much like the UK, was largely unprepared to handle the pandemic. The director of the Center for Coordination of Health Alerts and Emergencies of the Ministry of Health even claimed in late February of 2020 that, quote, "In Spain, there is no virus. The disease is not being transmitted, and there are no cases," end quote. That said, Spain canceled its first major event due to the threat of COVID-19 on February 12th. The Mobile World Congress was scheduled to be held in Barcelona from February 24th to the 27th.
So clearly, despite this late start, countries did get plans together eventually and enact lockdowns. If you guys all wouldn't mind describing what the first one looked like and how that affected people and just some general information about it.
So because of of the decentralized system in Italy, the first lockdowns were all regional. The northern regions were hit first with COVID, and they were the first to go into lockdown almost immediately after the first case was confirmed in late February. Unfortunately, this actually kind of had the opposite effect that a lockdown should, in that it caused a bunch of residents to flee south to get away from the lockdowns, unknowingly bringing COVID with them. A national lockdown was not put into place until March 11th, and by that time, cases were skyrocketing and hospitals were overrun with COVID patients. At the peak of the lockdown in April, Italy was given a stringency level of 93.52 out of 100 on the Oxford COVID-19 response tracker. This first lockdown lasted until late May, when Italy tried to reopen so that there would still be a tourist season, even if it was a small one.
Lithuania looked a bit different in the beginning. The first lockdown was nationwide and pretty stringent. Just kind of like the US, schools, non-essential workplaces, and borders were closed. Gatherings over 10 people and internal movement were restricted. On the same Oxford response tracker, Lithuania received a stringency level of 81.48 out of a possible 100. And this is even as case numbers remained under 1,000. And in regards to healthcare, diagnostic services, elective hospitalizations, and non-emergency surgeries were postponed. And hospital visitations, inpatient social services, home visits, and daycare centers were prohibited. The lockdown was originally planned to last just till March 30th, 2020, but was extended until June 17th by the Lithuanian government.
Similar to Lithuania, the initial lockdown of the UK was very strict and also very nationalized. It was given a 79 out of 100 on the Oxford COVID government tracker. And while it was off to a slow start, with restaurants, pubs, and cafes being forced to close earlier, while other businesses were told to slowly close when possible, by March 23rd, 2020, all non-essential businesses, schools, and religious institutions were closed. During this time, the government provided large amounts of money to unemployment funds as well as social care funds to ensure residents could safely miss work. While reopening plans began to be released in late May, businesses did not begin to open until mid-July, but much of the country remained under significant locally enforced lockdown throughout the summer.
And similar to the UK, how they had a very strict lockdown, France also had a strict lockdown as well, but they eased into it at the start of it. So the government started to initiate closures of schools. They banned gatherings of more than 1,000 people and closed all non-essential public places in about mid-March. But then March 16th was when a period of full confinement was declared. And this is when the first lockdown started, which was extended twice until May 11th. And during this heightened time during April, the France was declared 87.96 on the Oxford response tracker. And this first wave was met with a strong policy response, very strict by the government, including that citizens could only leave their residences with proper documentation, or they would be fined up to 450 euros. And after 4 fines, they could experience 6 months of prison, which is really extreme. But
in terms of Germany's response, at least during the beginning of the pandemic, they had a little bit of a difficult time finding a unified kind of lockdown protocol for the entire country. So cases began to spike in March 2020. Angela Merkel was finally able to impose a lockdown in March, and it was pretty stringent, so ranked 76 out of 100 on the Oxford response tracker. Cases began to quell, and she was facing pressure from regional leaders, so the lockdown restrictions actually eased a little bit in April before they picked up again. And the pushback was in part because of the first wave in Germany was a lot more mild than compared to the rest of the world and the EU specifically. So fatality rates for Germany were hovering around 1 to 2%, creating this idea of the German exception, or somehow Germany seems to be a little bit more immune to the toll of the virus than other countries. But now that we look back at the pandemic and look back at this first wave, it's more apparent that the reason for those low fatality rates was a combo of the fact that mostly young people were suffering from the initial infection, so they weren't dying as frequently. And there was a high capacity of the healthcare system as well that was able to feed into that. So Germany was pretty strict in the beginning of the pandemic, but people began to protest and push back against the pandemic laws, especially during the later summer months in that first wave.
Spain had a pretty similar lockdown timeline to France. Certain metropolitan areas of Spain began to lock down as early as March 9th, and then the rest of the country was quick to follow. Spain's first lockdown was announced on March 14th when the country declared a state of alarm, allowing the Minister of Health to do what was necessary to reinforce the SNS, which is the public healthcare system in Spain. During the first lockdown, Spaniards remained at home and they were only allowed to leave their homes for groceries, emergency hospital visits, and 1 hour of exercise per day. After international pressure to relieve some of the harsh measures for young Spaniards, the government permitted children to walk outside with an adult for 1 hour beginning April 26th. In April 2020, a University of Oxford stringency index rated Spain's lockdown as 85 out of 100. So it was pretty strict as well.
Wow, that all sounds very, very concerning with lockdown levels. But if a few of you could go a little deeper and maybe explain a little bit what the results of the first wave and whether these lockdowns worked for these countries.
I think I could speak to that. Lithuania, I feel like, had a very effective lockdown. By June, it was almost entirely lifted because the total incidence of COVID-19 was below 100,000 and 90% of new COVID cases were localized and controlled outbreaks. And really only a ban on international travel was maintained. I think the Lithuanian people really adhered to lockdown restrictions during the first wave, either from concern for public health or fear of the fines that were threatened by the government for anyone breaking lockdown restrictions.
And I think Germany had an interesting take on this too, and I spoke to it a little bit in the previous question, but for Germany, at least the lockdown in the beginning was extremely effective, and at that point almost too effective, to the point where there was an overconfidence in Germany that led people not to fear the virus as much as they did in other countries because of those initial low fatality rates. So because of this, in the later summer months, there was a push to repeal the lockdown protocols. So just as the situation began to stabilize Germany and the lockdown was repealed, the country experiences a surge in cases, which just highlights the necessity of kind of a unified approach and strict lockdown procedures. So in the late summer months, as travel restrictions were lifted, the share of cases with exposure outside of Germany rose, peaking at 49% of cases 9 weeks after the restrictions were lifted. So just again, highlighting the importance of that lockdown protocol for Germany.
Definitely, yeah. So after all of that, what did summer 2020 look like for your countries? Were things beginning to reopen, seem hopeful for the fall? What was going on there?
I can speak a little bit about what France's looked like. So, as I said before, they began easing their restrictions after the 2 weeks of extended lockdown around May 11th because of decreased COVID hospitalizations as well as decreased numbers of patients in intensive care, which was absolutely amazing. But they also did this to avoid the collapse of the French economy, which was suffering greatly at the time.
Yeah, the UK also had a pretty similar experience with a lot of Europe, reopening pretty significantly. Pools, gyms, cosmetic salons, sports, and even restaurants were allowed to reopen in July and August. The government went so far even to encourage indoor dining by subsidizing half the cost under the Eat Out to Help Out scheme. When after 3 weeks of this in early August, it was shown it could be responsible for up to 17% of COVID clusters, this program was quickly disbanded. So that is all we have for today. Thank you for everyone who tuned in. And I hope you were able to learn something new about how Europe handled the first wave. I wish we could say that this was the end of the story, but next week we'll be analyzing the tragic second wave and some of the key comparisons between these two. Thanks for listening to Healthcare and Healing, and have a great day.